Hello, welcome to another episode of the Anna Dice podcast. And today we're going to be talking about plastic surgery. Everything you should know before going for that procedure and the right questions you need to be asking your plastic surgeon. It's going to be a great episode. And this episode will be a special edition episode. So for you to be able to access the full episode, you need to be a member of the AnnaDice.club, which is our exclusive online member community where you can access interviews with experts, amazing content. Going to be accessing a community of like-minded individuals who are going to be cheering you on to level up your life to the best possible potential that you can achieve, and healthy African menu plans. So if you have not become a member, please do, because then you'll be able to hear this entire episode. So this episode is good for anybody who's thinking about plastic surgery, anybody who is asking questions about what kind of procedure is right for them. And, it's not to judge or shame anybody who has ever done it or been there. It is just to open up the discussion with an expert who has gracefully agreed to come to the show, Dr. Mukami. Welcome.
Thank you so
Dr.
much.
Mukami is a plastic and You knew I was going to do this.
Can I help you out?
Yes. No, actually, no, tell me. They'll edit that part. Plastic?
Reconstructive and aesthetic surgeon.
Okay. With Dr. Mukami, she's a plastic and reconstructive aesthetic surgeon. Oh my gosh, it's quite a mouthful, but she is totally the right person to help us answer these questions. Welcome.
Thank you.
So let's start with a little bit of background.
Okay.
How did you find yourself in this profession? What inspired you and what are your areas of expertise?
I always say that it's fate that I landed in this profession.
Mm-hmm.
Of course, usual medical school, doctor, medical officer.
Mm-hmm.
While in Kitale, which was my station, I was performing an appendectomy where you remove the appendix. Yeah.
Uh-huh.
And while I was suturing the skin, one of my senior doctors saw what the technique that I was using, and he said, "Oh my God, you should be a plastic surgeon."
Wow.
And I'm like, okay, but then it was far-fetched.
Okay.
Back then, I wouldn't have thought about it. Down the line, one of our plastic surgeons, my seniors, came to the town. He's from there, and he was conducting a project. And I was the lead on that. So he mentored me for 2 years. After that, I was able to join the program. And here I am.
Wow, fantastic.
Yes.
It is actually a really needed field because, here we are. A lot of people are asking for it. And we need the right people who have the right techniques.
Yes.
So you are certified. You're not only qualified, but you're certified.
Yes.
So tell us more about that.
Plastic surgery, I've been in school for 13 years.
Wow.
Believe it or not.
That's a long time.
Yes. So one of the reasons I'm here also is to create awareness about safe plastic surgery and safe plastic surgery in Kenya. So for you to get safe plastic surgery, you need to be qualified and certified.
Okay.
That means by the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons.
Oh, so there's a whole body that regulates plastic surgery in Kenya.
Yes.
Okay.
So if you're thinking about getting plastic surgery in Kenya, and I think I really need to emphasize this, go online, look for your doctor, your plastic surgeon, Google them. If not, go to the Kenya Society of Plastic, Reconstructive and Aesthetic Surgeons website. We do have one.
Oh, nice. I'll link it in the show notes, actually.
Yes, please. You can even call our secretariat and ask, is this surgeon so-and-so one of your members? And they'll tell you yes. Then once you have this name, you can confidently go in for a consultation.
Wow.
I cannot overemphasize this.
That is so important because they've gone through the program,
Yes.
the plastic surgery masters. It's a master's program.
It's a master's program.
And on top of that, they've gone through a rigorous certification
Yes.
to allow them to be board certified.
Yes.
Wow. Okay. And how many are they in Kenya?
We are 20.
Only?
Yes. We are very few.
Wow.
But we do have more in training.
Okay.
So in the coming years, we will
have more
plastic surgeons in the country.
Okay.
Yes.
And what's your area of expertise?
So when you train in plastic surgery, you train as a reconstructive surgeon. This means you're dealing with burns, post-tumor reconstruction. Then there is now the cosmetic part or the aesthetic part.
Okay.
Liposuction, tummy tucks, breasts. So we do both reconstruction and aesthetic.
Okay.
We just don't deal with either. But one can choose to super specialize again on one specific thing.
Yeah,
yes.
Which is actually a good thing because if I want, say, breast lift, I should go to the one who specializes in breast lifts as opposed to the jack of all trades, right?
Exactly.
Okay, but actually, let's break down all these terms. They're trendy, liposuction, tummy tuck, breast augmentation, butt augmentation. So just break down those common ones.
Okay, let's start with liposuction. I think that's the one that is really trending right now.
Yes.
So for liposuction, we basically remove fat from the stubborn areas. And Mercute can be done in both male and female.
Ah, okay.
Yes. We do have male clients.
Yeah, who go for lipo.
So for females, the stubborn areas are the tummy, of course.
Yes.
We have arms, underarms.
Exactly.
The back, where the bra strap is.
Yes.
It's quite stubborn.
Love handles. Okay.
For females who would like to have the inner thigh gap, which is quite
why is it a big deal? Why?
Is for people who go to the beach.
Okay.
And they want
one side,
thigh gap.
Thanks.
So that's liposuction.
Okay.
We use special tools we call cannulas. We inject some fluid. And then we liposuck. And subsequently, if we want to augment some special areas, that is, transfer that fat, we can process it, make it clean. Because remember, when we are performing the liposuction, it may be mixed with some blood.
Yeah.
So we have to process it.
Yeah.
Then if you want us to augment some special areas,
you use that fat.
Yes. The hip area or the butt.
Oh.
That's what for the butt area, we call it a BBL.
Okay. What does it stand for? Okay. Oh, it's a long term?
It's a long term.
Okay, Sawa.
Yes.
All right. So is that done within the same, around the same time, or you have to come again and do, so say you remove fat from this area, I want it in my butt, so I'll go recover and come again for the butt augmentation?
Yes.
Yeah.
We have to do it in the same sitting because this fat is fresh and we cannot store it.
Okay.
Yes.
Okay.
So we just do it in the same sitting. And remember, again, we do not want to put you through anesthesia twice.
Yes.
So let's just do it in one sitting so that you can recover once.
Okay.
Yes.
So that's lipo and that's butt augmentation. Are there other things you could do to lift the butt up or to make it bigger? What is it?
Yes. We can use implants, although we do not really advocate for that. But there are people who like implants. I'm sure you've seen it in the West, especially Brazilians. They really like the implants, but we prefer to use fat because it has come from the host. So you will accept it better. It's cheaper. There'll be no reaction. So we prefer to use fat to augment the butt.
Okay.
Yes.
Then the breast, obviously, that's a common one.
Oh, the breast, yes. It's very common.
Yeah.
We have different things we can do to the breast. I think let me start with what is most common and what affects more people. And this is what we call gigantomastia.
Okay.
So for gigantomastia, it's a condition where you have big breasts.
Okay.
And it can result from different causes.
Yeah.
So number one, it can be hereditary. If your mother or your grandmother or your aunt has the same condition, as a child, you could get it. So you'll find that it affects ladies or girls at the puberty.
Oh, okay.
So you'll find that they're very affected psychologically. They're not able to play with their friends. They don't have fitting clothes, bras.
Yeah, especially bras.
Exactly. They have grooves.
Okay.
On the shoulder
because of the bra, you know. Okay.
Cutting in
Wow.
on the skin. They have blisters underneath the breasts. Actually, when we do that surgery, which is a breast reduction, we do not consider it as a cosmetic surgery. It is a
necessary,
life-altering, necessary surgery.
I agree with you because I saw this influencer and she went for one. Hey, Lorna. She's been sharing her journey online.
Yes.
And I'm telling you, the confidence this girl has after her breast reduction is just amazing. And it's one of the surgeries, I agree with you. It's life-changing because the confidence, you know, the back issues.
Yes.
They also end up having back issues,
yes,
right?
You have back pain, neck pain, shoulder pain. You're just uncomfortable. You have mental, psychological issues.
Wow.
So we're really trying to spread awareness also, to bring in more people, because there are so many women and girls suffering out there, but they do not know that it's a condition that can be treated. So they suffer silently. So one of our main aims is to try and create awareness.
Absolutely.
Yes.
And for those of us who have breastfed and our boobs are,
oh yes,
what are the options?
You have many options.
Okay.
Because when you breastfeed, what happens? You get ptosis. By ptosis, I mean your breasts droop.
Okay. So is that the muscular tissue? There's no muscular tissue.
No
okay.
muscular tissue. So what we can do with that is what we call a breast lift, or more complex terms, it's a mastopexy.
Okay.
Yes.
Okay.
So we just lift your breasts. And the satisfaction rates, I can tell you, are quite high.
Oh, yes.
And the confidence.
Absolutely. Absolutely. Because we didn't ask for that. You know, wanted the baby, but we didn't want that. Yeah. Okay.
And you'll find that most women will come telling us, oh my God, I just want to be braless.
Yeah.
So that is what we can offer. The second option is definitely breast implants, which are quite, they're picking up in Kenya in comparison to the West. For the implants, we get more so younger clients who have had maybe exposure to maybe the Western culture.
Oh, okay.
But yes, they are picking up, and that is another option that we can offer when it comes to the breasts.
Okay.
Subsequently, if you feel you do not want a foreign body in you, we can transfer fat. Yes, and that is actually picking up and quite a good solution.
Okay. How long term is that?
Let's give it 2 to 3 years.
For that fat to, you know,
yes,
create the effect that you need.
Yes.
And then what happens after?
The only issue is, and maybe what we need to discuss with the client, is that we may need multiple sessions.
Oh.
Because remember, when we inject the fat, 50 to 60% will be reabsorbed by the body.
Okay.
So I will discuss with you.
Yeah.
That, well, this is one of the best options.
Yeah.
Because it's not a foreign body. It will give you a very full breast.
Yeah.
But we may need multiple sessions.
Okay.
But you'll find that most clients are so happy with it.
Yeah.
That they go for it.
Okay. So multiple is what? Once every 2 years?
2-3 sessions. Yes.
And then you're good forever.
And then you're good.
Forever.
Yes. Because remember, it is your fat.
Okay.
And then you will get liposuction concurrently.
Okay.
So you lose your tummy and you gain breasts.
Ish. It's sounding too good.
What else?
It's sounding really too good. I mean, and it's important for people to understand those options.
Yes.
Because, you know, they're going to spend a lot of money, you know, to go through this procedure, and also the risk factors. I think we should also talk about side effects.
Let's go to that.
Yeah.
When you come for cosmetic surgery, I will not just oversell it to you.
Okay.
I will tell you the risks. Because remember, cosmetic surgery is a surgery.
Yeah.
Just like any surgery, there are risks. So number one, if it's an invasive surgery, you're going to be given anesthesia.
Yeah.
So I will tell you the anesthetic risks. This and this may happen. Of course, when you're given anesthesia, just like any other surgery. Number 2, we have to look if you have comorbid conditions. Are you diabetic? Are you hypertensive? We have to look out for those conditions. Sometimes if you have comorbid conditions, we may have to defer you getting cosmetic surgery.
Oh, okay.
So that's why a consultation is very important. You just don't go getting surgery from anybody.
Okay.
That's why we are really insisting go to the right person.
Yeah. At least for the consultation first. That should always be your starting point.
Yes.
The consultation.
Yes.
Then, you as a consultant will be able to now guide on the right procedure, even the right surgeon.
Yes.
Okay.
And can you imagine we just don't perform the cosmetic surgery at the beginning? Most of the time we have 2 to 3 consultations.
Okay.
Before we decide or we take you to theater.
Yeah.
Because we want you to understand what you're asking for and what you will get. So we just don't rush to theater.
Yeah.
We're not scalpel happy.
Yes.
Or knife happy.
Yes.
Yes.
So what, I want cosmetic surgery. Where do I start? Okay, so I start with a consultant.
Yes.
But what should I be looking out for when, we decide this is a plastic surgeon? Just as a second level,
yes.
What should I be doing?
So the first thing, and I think what we've clearly established is choosing the right person.
Yes.
Once you've chosen the right person is next the facility, which you and your surgeon at your discretion.
Yeah.
Then after that, of course, is the right procedure. Because not every procedure is suited for each individual. It will be tailored to you.
Yeah.
Depending on what you want.
Yeah.
Yes.
Yeah.
This procedure may be right for this person, but not for you. So that's very important for you to note.
Yeah.
So that's one thing to note.
Yeah.
Then remember, we have to have a candid discussion.
It's true. Yeah.
We are not going to hide under something.
Yeah.
We are going to tell you the truth. Then you have to make the decision as an adult. Then remember, at the end of it all, there's the consent that you sign.
Yeah.
Saying that you do understand the risks.
Okay. Okay.
That I have outlined to you.
Okay.
The consent, it is signed by anyone undergoing surgery.
Okay.
But for plastic surgery, it's tailored differently.
Oh, okay.
Because for plastic surgery, it is it's an elective surgery.
Yes.
Like you have decided you want it. And then we tailor it to each specific surgery or procedure. So if you decide you're coming for Botox, it is tailored to Botox. If it's a liposuction, it is tailored to liposuction. Then after that, what we also don't take lightly is the aftercare. The aftercare may be as important as the surgery itself in terms of results.
Yeah.
Yeah.
Okay.
You may perform the surgery very well, very meticulous, but if there's no proper aftercare, the results are wiped away. So we have to organize aftercare to the letter. For example, liposuction. The aftercare is quite something heavy, if I may say, because after liposuction, number 1, you need lymphatic massages.
Oh, yes. Okay.
Which are done by an expert.
Not just anybody.
Not just anybody.
Yeah.
Because if they're not done, number 1, the fluid that is retained will not
flow.
Will not flow.
Yeah.
And number 2, you will not be able to maintain that, let me say, nice figure.
Yeah.
The swelling, the bruising, it helps with the pain control also.
Okay.
So it's very important. Number 2, you need compression dressing. We call it a faja. So you need 2 to 3 of those compression dressings. Number 3, you need very good pain control. Of course, you'll need someone to take care of you 1 or 2, 3 days.
Yeah.
Before you're able to get back to your normal activities.
Self. So this is after a lipo, it's 3-4 days before you're back to being mobile and everything?
We encourage you to be mobile on the first
day. Okay.
Yes.
Okay.
Because we do not want you to get a clot So nowadays, the beauty with plastic surgery, they're done. They can be done as outpatient cases.
Wow.
Yes.
So you go in, breast lift, we're back home, same day.
Yes, it's possible.
Okay.
Things have evolved.
Yeah.
And we are happy about that.
Yeah.
So the aftercare now, we want you to ambulate on the first day, so that we do not get clots. So if you're putting you on anticoagulation, that's very important. Pain control. We want you to be comfortable. I mean, we care about you. So if it's those lymphatic massages that you need, close to 10 sessions, the compression dressings. So those are the things we really need to sit down and discuss.
Exactly. Actually, because I mean, your life will be affected for a couple of weeks there. But once you heal, you shouldn't expect to keep going for reviews or anything like that. Okay, so you're good to go.
Yes. Once you're happy and I'm happy, then I will allow you now to integrate to your normal life.
Okay.
Yes.
Okay.
I think we want you to start integrating as early as possible. Because if you play a sick role, you are more prone to getting complications.
It's like your mind does exactly what you're thinking. Okay.
Yes,
okay.
So I want you to start ambulating early. I want you to even go to work early.
Yeah.
But as long as your body can tolerate it,
yes.
I still want you to listen to your body, feel what is it. Yes.
Let's talk about, the excellent surgeons. There's an assumption that, if they're online, their pages are vibrant, these are the best surgeons.
Yes.
So is it that the excellent surgeons are online, are not online? Where should we, what should we think of these surgeons who, are quite loud online? What's this assumption?
Can I be honest? Some of the best plastic surgeons I know are not online.
Okay.
And those are my teachers.
Wow.
Yes.
Okay.
The person, if you as Anne came to me and told me I have this and this and this, and I need this and this and this, I'd refer you to
some of the best.
Yes. They're not even online. Because remember, for the longest time as doctors and surgeons, let's say the code of ethics, for the longest time, we were restricted to a lot of activity online. But then we realized our silence is not working for us. So the younger generation, the younger surgeons, now we have decided, no, we need to speak up.
Yeah.
We need to protect our patients because our silence is now hurting our patients.
Yeah.
That's why you will see us trying to create awareness.
Okay.
So that people know there are registered, licensed plastic surgeons. Can you imagine there are people who do not know that there are plastic surgeons in Kenya?
Yeah.
Yes, and I do not blame them to some extent.
Exactly.
Because we've been silent.
Yeah, for a while.
For a while.
Exactly.
Yes.
Until there are those that are now quite, and we're seeing a lot of before and after photos, and, the assumption is these are the best, the excellent ones are here and they're online.
Yes.
But what you're saying is the best place is actually to go to that body and, that's how you get the full picture.
Yes, but we are trying.
Okay.
We are trying. We are doing our best to make sure that the right people are also being visible online. Yes.
It's important.
It is important.
Yeah.
Yes, I agree. We can no longer hide under the blanket and say social media has no role. It has a role.
Really
we
does.
need to create awareness. And to be honest, the younger generation is trying to bridge that gap. Yes.
Agreed. Now, there's a lot of there has been a lot of stigma around plastic surgery.
Yes.
And, it's like if she went, and I don't know why people feel entitled to know about somebody's body and life. Like, I mean, so she went, she had a butt augmentation and she's here and she's not telling us, okay, hell, it's their life, it's their prerogative. So where do you think that stigma actually came from?
The stigma is still there.
Yeah.
You'll find that people will go for plastic surgery and they will not even want. They will even make you sign a
non-disclosure
as the surgeon.
Wow.
Yes, like I do not want you to mention. It's serious to the extent that some ladies will not even inform their significant other. Yes, the stigma is actually quite high. People feel that people who go for plastic surgery are vain. Can you imagine people think that I, as a plastic surgeon, am vain?
What?
Yes.
Oh, I get. It could be the stigma around you're money-minded, probably don't care about somebody's health. You just want to...
Why do I want to change someone's appearance? But then I'm like, if it makes someone happy, why are you so concerned about that other person?
Exactly.
If you don't want plastic surgery, it's
Don't.
fine.
Exactly.
It's fine. So the stigma around it is the fact that people feel that if you need to change a certain aspect of your body, you're vain. That's where the stigma comes from. But I need people to understand that it's a personal decision. And if you want to go for plastic surgery, well and good. Can I be honest? Personally, I would.
Oh, you would?
Why would I advocate for something that I wouldn't?
Exactly.
I mean, I would be the worst plastic surgeon on earth.
That is so true.
It would be so hypocritical.
Actually, we should ask, if you're getting a plastic surgeon, ask them, would you get plastic?
Yes.
Would you?
Yes. It would be quite hypocritical.
Yeah.
So because that is what is making people now go to back street. Yes, that fear, that stigma, that, oh my God, if I tell people, they'll think I'm too vain. So that's why also creating awareness, talking about it, will make it the norm. That's why in the Western, plastic surgery is like getting Botox is like going to the chemist.
Yeah, it's a no-brainer.
Yeah, like it's a chemist. Every other street has a plastic surgeon.
And a Botox
specialist.
Yeah.
So the first step is creating awareness, making people see that it's not vain, it's not vanity, and it's a personal choice. If you want it,
well and
cheers,
good.
Man.
And I find that a bit, okay, sorry to use this, but two-faced, because if you didn't like your teeth, you'd go to a dentist and they would fix it up and you'd have a beautiful smile.
Yes.
Same with hair, same with so many things. So this is just another way of enhancing your look, maybe a little bit more intrusive and maybe slightly higher risk.
Yes.
But it's in the same category. Everybody wants to look good.
Exactly.
Everybody wants to feel confident in their skin.
Yes.
And it's like you said, it's their choice. It's their prerogative. And the judgment and the shaming around that is what is, in a way, I think, propagating the what do you call, the illicit practices that are out there. Don't you think so?
Yes, it is.
Yeah.
Because you do not want to go to the right person or the right channels. You just want to go to a place backstreet.
Yeah,
get it done quickly.
Exactly.
And go back to your normal activities. So by creating awareness, we'll make it the norm.
Yeah.
Get your plastic surgery done. It's bad to the extent that people will opt to go to outside countries like Turkey.
Really?
Yes. You have tourists, we call it tourist plastic surgery.
Okay.
Like someone will say, okay, I'm going to buy clothes in Turkey. Kumba, they've gone to get plastic surgery.
I hope they're doing their research on who's doing the...
And the people they're going to are not even plastic surgeons.
What are they?
Estheticians.
Wow.
There's a difference between an esthetician and a plastic surgeon.
Okay, break it down.
An esthetician has maybe done a 6-month course.
So you're allowing somebody who's done a certificate,
it's a certificate.
It's a certificate.
You're right.
To do surgery on you? That's crazy.
Yet you've left a plastic surgeon here who's gone to school for
13 years.
And then I think something else I want to bring out is the white man syndrome. People believe that Caucasians and it's quite unfortunate that they will make better surgeons, better doctors than their own people here, which is quite unfortunate.
So we're being racist to our own kind.
That thing really hurts. I will not lie to you.
Yeah, I can only imagine
It
that
really
you're
hurts.
bypassing, and we have the qualified surgeons here, and you're
Yes.
bypassing you're allowing even yourself to spend more out
You
there.
spend a lot. You
Yeah.
spend money on a ticket.
Mm-hmm.
You spend money on the surgeon who will
Yeah.
charge a lot.
Yeah.
You spend money on a hotel room because you cannot go get a tummy tuck and immediately jump on a flight and come
Yeah.
back to Kenya. You need to rest a bit.
Crazy.
Yeah.
Yeah.
So, yeah.
The plastic surgery has happened, but if something goes wrong,
Yes.
what should be the course of action? And what have you seen go wrong?
First, what I think I need people to understand is that plastic surgery is surgery like any other surgery. So by the time you're thinking about it or making that decision, that is something that should be at the back of your mind.
Mm-hmm.
But if you go to an expert,
Mm-hmm.
of course, your chances are reduced. Number two, you should have an in-depth discussion.
Yeah.
That's why 2 to 3 consultations are necessary.
Yeah.
So that you have that in mind.
Yeah.
Complications can occur during or after. If they occur during, then the surgeon is able to mitigate.
Mm-hmm.
If they occur after, the first thing is to contact your surgeon immediately. Then after that, seek medical help, like take yourself to a hospital, right?
Mm-hmm.
Because remember, complications can occur from maybe, let's categorize them to local and systemic. And by local, I mean if it's a wound, maybe it's an infection, which can be dealt with easily. Maybe to complications like getting a blood clot.
Okay.
Which, if the right thing is done, that is,
shouldn't happen.
Ambulate early.
Yeah.
Get your blood thinners. Still may happen because anyway, you have no control over nature. Sometimes you also have confounding factors as a patient.
Yeah.
Should be caught and treated.
Yeah.
Yes.
Okay.
But that discussion
is really important.
Yes. Because sometimes it does happen. But by the fact that you discussed with your surgeon, you will understand as the patient.
Yeah.
Yes, by then my doctor told me this may happen.
Yeah.
And it has happened.
Yeah.
But we've treated it. We've caught it early because he told me if I feel this way or if I start getting this symptom, I contact him or her immediately. That's why this consultation is very important.
Yes. And working with somebody you can actually trust.
Exactly.
Let's talk about trust. I mean, where can we go online to read real reviews? Like, I've identified Dr. B and I want to know everything, what people have said about him, previous patients. Where can somebody get that?
Can I be honest? Because of the stigma, you will rarely get reviews.
People don't want to go in there and say, true.
They will rarely tell you they won't admit until they got plastic surgery. That's why you will not get.
Okay.
But you as the patient, if you decide you're going to surgeon so-and-so, and you go for your first consultation, there's that rapport you will form. And you know your instinct.
Oh, yeah, the gut.
Please listen to your instinct.
Yeah.
Please.
I love that you've said that.
It will never fail you. It won't.
And I feel like those that have encountered really bad situations did probably a lot of research, because I think as women, we are great at researching.
Yes.
We want to know, we'll talk to people, who are willing to share. We'll go online and read up on the procedures, but probably didn't listen to their gut.
Yes. Sometimes the issue is you really want the procedure. But maybe the price quoted is a little bit high. Then you feel like you want a cheaper option.
Okay.
But remember, the cheaper option comes at a cost.
Yeah.
I think I really want to put that out there. I'd rather you save up. Pole. Because remember, anyway, it's plastic surgery.
Yeah.
Like, it's not an emergency.
Yeah.
Have it done by an expert.
Okay.
I think that is my mantra for today.
Yeah.
My mantra for today
is
you would want a cheaper option, but the cost at the end of the day,
it's
you
gonna
might
be too
regret
much
it for the rest of your life.
So true.
Yes.
We've had horror stories of people who went for, again, outside the country, for I think, was it a lipo and a tummy tuck?
Yes.
And they ended up losing their belly button.
Oh, yes.
That has happened?
Actually, we've dealt with complications. A patient comes to you or a client comes to you, they've gone outside the country.
Now you're correcting things. That's why I say, you should have come to me first. Okay.
Yes.
Okay.
So, yeah.
And when it comes to cost, will insurance cover for these procedures?
Unfortunately, insurance does not cover most procedures. We are trying to work on that, I can tell you. And part of it is by raising awareness that these procedures are needed by people. And once we do that, hopefully they will come on board.
Okay.
Yes.
But you feel like most procedures we don't need, other than the breast reduction?
Let's give it 40 to 50%. Maybe a need.
Okay.
Then the rest
are ones.
Yes.
So it becomes hard to justify liposuction to an insurance provider.
Sometimes liposuction, you can have liposuction for other medical conditions.
Okay.
Not necessarily just the cosmetic purpose.
Yes.
So those we are trying to advocate for.
Okay.
People who have what we call lymphedema. The limb is swollen. I'm sure you've seen such ladies or gents.
And they need like compression stuff, socks. Yeah.
Yes. Like that, you can treat with liposuction. So for those, I think we could advocate for them.
That's really important
there's so
to
much
know.
You can do as a plastic surgeon. That's why we go to school for so long.
I know. Yeah. And it's important for, like you said, life-altering procedures. And for people to understand, like now you say edema is, it's a very stressful condition.
It's debilitating, especially if you get a wound, it never heals.
Yeah.
So the patient is distressed all the time.
Yeah, and if they have a solution through plastic surgery, and I'm sure there are many, many other instances.
Yes.
So now let's talk about fillers.
Okay.
And side effects. And there's a new trend, skin lightening trend called, they're using a chemical called glutathione.
Okay.
So tell us, are they risky? What chemicals are these? I mean, in my mind, I've always imagined Botox is chemicals, stay away.
Let me start with the fillers.
Yeah.
Okay, a filler is we call them, so fillers, Botox. Those are non-surgical.
Okay.
Facial rejuvenation procedures, and they are very common because they are office-based procedures, and of course you want a beautiful glowing skin.
Yeah.
Which is non-invasive.
Okay.
So for the fillers, they are safe. The most common one we use is hyaluronic acid. The only thing, and again, it needs to be done by an expert.
Yeah.
Because the only problem is that if you inject it into a blood vessel, it will clog the blood vessel, cutting off blood supply.
No way.
And then you get necrosis.
Okay, so what's that? Like a patch?
Yes. Without blood supply, which dies off. It becomes black and falls off.
No way.
Yeah.
On your face.
On your face.
That's crazy.
So, I don't know if you remember Joanne Rivers.
Yes.
You remember how her face used to look?
She couldn't move. I know. Yes.
Yeah.
Oh, because of the
she had
fillers.
gotten too many. Yeah.
Okay.
So, it's done by someone who understands facial anatomy, which is very complex.
Okay.
It is beautiful.
Yeah.
Yeah. Same to Botox.
Okay. Same to lip fillers.
Yes. You see?
They
are very...
so they just use that acid?
Yes.
Which is natural?
I don't know if the hyaluronic acid serum. If you use that, oh my God, your skin glows. It becomes plump because it retains moisture.
Okay.
So it's the same thing.
It's the same thing. So you can use it externally and you can use it to fill the face. Okay.
Yes.
So once I have the fillers, I still have to do my facial care, right?
Oh, facial care is mandatory.
Right?
Everywhere, anywhere, twice a day.
Yes, yes. All right.
Yes.
And the glutathione?
Glutathione, again, please let it be done by an expert. And
maybe we can explain what glutathione is.
glutathione is a chemical that is used in skin lightening. It suppresses melanin, which is what gives us this dark pigmentation. It should be done by an expert, because if given at a fast rate, of course, it will have deleterious effects. I'm sure you've heard of several cases, which I really don't want to go into.
Where they were overdosed?
Yes.
Wow.
So again, please let it be done by someone who know what they're doing.
And somebody who knows what they're doing are really going to charge for that. So you have to be ready, because this is a lifestyle thing. Once you start glutathione, you have to keep going.
You have to sustain it.
For how long? Forever?
Oh, you just can't do it once.
So how many times do they get the thing?
Almost forever.
Once a year? Once a month?
Even more frequent.
Really?
If you really want to sustain that tone, skin tone.
Why do you think women are going for that, in your experience?
There is the belief that if you have a lighter skin tone, you're more attractive.
Okay.
So I think that's the reason why people will go for it.
Well, personally, this is the ones I don't agree. Personally, I have to put it out there. I think every skin tone is beautiful. Again, not judging or shaming, because they have their reasons. But it's just to put it out there that every skin tone is beautiful.
Definitely.
And I do not think you need to put your life or your health at risk to have a different skin tone. And again, you said, if you want it done, it's your prerogative.
Yes.
But just make sure you're ready to sustain the cost and the frequency of it, because it's for life. And what if you stop somewhere in the middle of it?
Or you'll go back to your original skin tone, because remember, your body is still producing melanin.
Yeah.
It's not going anywhere.
But if it's done properly, no side effects.
If it's done properly.
No side effects.
Yeah, I think that's our teaching for today.
Okay. Yeah, again, we have to keep emphasizing, go to the right people, because there are quacks out there and they're ready to take advantage. Now, let's talk about the last, and a lot of my audience are mommies.
Yes.
They may be wondering, is there a mommy makeover?
Oh, I love that one.
What entails that?
So a mommy makeover is a package. Let me call it a package, because it entails different things.
Yeah.
So remember, when you give birth, your body undergoes severe stress.
Yeah.
And then after that, you breastfeed. So what we do, we wait for you to deliver, of course, and finish breastfeeding. And make sure that you're not planning to have another pregnancy.
Okay.
Yes.
That's key.
Yes.
Okay.
Because the work is,
So after lipo, you can have a baby?
After lipo, you can have a baby.
Okay.
Yes.
You can?
Yes.
All right.
What we usually advocate for finishing, giving birth is a tummy tuck.
Okay.
Because we do work on your muscle. We call it the rectus muscle. Because when you give birth,
the abs?
The abs.
Yeah.
It gaps. But it may happen, you may get pregnant. Sometimes nature.
So is that
otherwise?
I know, right? So does that become a risky pregnancy?
Not a risk. It's just that, you'll reverse the effects. So you'll have to come for another tummy tuck.
All right.
Yes.
Okay.
So in a mommy makeover, we work on your breasts. So be it a breast reduction, because remember, the breasts may enlarge. Be it a lift or implants. That's your choice. Or the discussion with your surgeon. Number 2, we work on your tummy. So for this one, it may be either lipo or a tummy tuck, because remember, some mothers will have one child.
True.
It's a personal choice. Then, of course, the lipo from the back, the thighs, the arms. Yes.
Okay.
So we are working on you wholly.
Wow.
To make sure you get your...
This is all in one sitting?
It depends.
Okay.
On who you are and how you are. If you're fit enough and we've had a good consultation with you and the anesthesiologist, the person who's going to give you the anesthesia drugs, because they have to see you, because that is key. Yeah. And they feel that you're fit enough, you do not have any comorbid conditions, recovery for you will be okay. That may be an option.
Okay.
But if we feel we need to stage those procedures,
Yeah,
that's also
gonna
an
happen.
option.
Yeah.
Yes.
Wow. It
Yes.
sounds like something.
It's
Something to consider.
It's something to consider.
Because when you think about it, as women, we're never the same after that. And a lot of women, walk around just feeling a bit off about themselves. So if they have that option.
Yes. Because even after going to the gym, there's that stubborn skin.
Tell me about it.
Fat.
Yes.
It will never go away. It will be looking at you.
Yeah, that's the thing.
Yeah.
And you know what? I feel it's important to mention that, when we are comparing our bodies, and especially as moms,
yes,
where you see a fit mom online,
yes,
and how they look,
yes,
and you spend hours, in the gym with the diets, and you will never look that way. It's important to recognize that they're probably not doing things the natural way.
Exactly. And that is why social media, okay, I agree, it's a beautiful tool and it has come a long way and it can help. You also need to measure what you pick up.
Okay.
Because you just see her in her clothes outside. Yes. You cannot see the scars that are inside.
Oh.
You don't know what she has done.
Exactly.
Maybe she has done a tummy tuck, lipo, and we're not shaming anyone. In fact, I'm just a brand ambassador, plastic surgery brand ambassador.
Clearly.
Yeah. But again, you don't know what she has done.
Yeah.
So you may be comparing yourself, over-exerting yourself. So you need to just work on your pace or with your pace and do things your way.
Absolutely. And I guess just loving you in your skin, whatever that looks like.
Yes.
Because again, even if you did the plastic surgeries, we still will never look the same.
Yeah, exactly.
Right?
Yes.
Do you get people saying, oh, I want a shape like whoever?
Oh, hey.
What do you tell them?
People come with photos.
Yes.
Kim Kardashian.
Right.
I want to look like this.
That waist and everything.
You're like, okay, how do we do this?
Yeah.
So yeah, the social media plays a big role, especially in cosmetic surgery.
Yeah.
Because they see that on TV, on social media.
Yeah.
They want us to replicate that.
Yeah.
So something else I think I want to also emphasize is expectation versus reality.
Yes.
That is a very important conversation we need to have with our patients.
Yeah.
And expectation versus reality. Because someone will come in with a photo, but to be honest, you
will
cannot
never
achieve that. So I have to be honest with you. I'm like, yes, we can do this and this and this, but you have to know that this is what we can achieve. So some patients will be like, okay, fine, I understand. Some you'll have to convince for a while, 2, 3, 4, 5 consultations down the line.
Really?
Yes.
Because there's some who are stuck on a thing, a mind. And are you able to pick out, because, okay, I don't know where to place like the like psychological issues where it comes to body dysmorphia. There's such a thing,
great,
right?
Great, you've brought that up.
Yeah, exactly. Because I'm like, for somebody, and I've heard stories of, and guys will try and discourage you from plastic surgery because they're like, I've heard once you start, you never stop, and is it part of an addiction, a body dysmorphia? How do you handle such patients?
Again, that's why consultation is important, because during consultation, I'm able to pick why you want the plastic surgery. There's that, what we call body dysmorphic disorder.
Okay, what is that exactly?
Body dysmorphic disorder is, do I call it it's a mental condition under the DSM-5. That's a book. Whereby the patient, when they look, she may be the most beautiful person on this earth. But when they look at themselves in the mirror, they see ugly.
Wow.
So they will come, and those patients tend to come for plastic surgery a lot.
Yeah.
Because they think they need to change something.
To make themselves look better.
Exactly. So during this consultation, we are able to pick up a few cues because there are some questionnaires that we have read when we study plastic surgery in school. That's a topic that we go through a lot because in the West, there are plastic surgeons who have been killed by patients who have body dysmorphic disorder.
No way.
Yes, it's very serious.
Wow.
When we say consultation is important,
It
there is a
is.
reason.
Yeah.
So during this consultation, we're able to determine, why do you want this plastic surgery? Is it to be better, or is it the fact that you have body because they'll tell you, my nose is deformed. But when I look at your nose, it's the most beautiful nose I've ever seen.
Yeah.
So when I detect this, I will bring on a psychologist or a psychiatrist.
Okay.
I will write a consultation. I'm like, okay, fine, I understand, but I want you to see Dr. So-and-so. Then Dr. So-and-so will see if they confirm they have body dysmorphic disorder.
That's it.
That's it.
You can't handle
I
them.
cannot. You should not operate. Yes.
Because they'll never stop.
They will never stop. Once you operate on that nose, you have opened a Pandora's box.
Oh, yeah. And you just need to watch Botched to know what happens by the end. It's actually really interesting to see how far they go.
Yes.
Wow. Okay. Yes. Let's talk about now, finally, how do we maintain this beautiful body? What lifestyle things do you end up letting your patients know? Because we've heard, again, and I'm bringing all this up because there's a lot of misinformation out there that once this fat is removed, the tummy fat through lipo, you could gain weight in other areas and you end up looking like a man, So how do you advise people to maintain that body?
So when we work with you, we are looking at you holistically. We're not just looking at you, from a cutting point of view. So we will encourage you to exercise regularly. That's very important. Then, of course, to maintain or rather eat healthy.
Yeah.
So you'll find us working hand in hand with nutritionists to ensure that you eat well. Because it's true. Yes, you remove the fat from the tummy. Because you've removed those fat cells, they will not come back.
Okay.
Oh, but if you eat whatever you want, your fries and mandazis, the fat will come back.
In other areas?
In other areas.
Wow.
And you'll come see me very angry.
Yes. Because you now look a bit unproportional.
Yeah.
Okay.
So I'll work with you holistically to make sure you're happy with your results in the long run.
Yeah.
Yes.
Because lifestyle is important.
Oh, very important. I want a healthy patient at the end of the day, or a client. I do not want you to get sick or get other comorbid conditions.
Okay.
Yes.
Wow. This has been amazing.
Thank
Dr.
you.
Mukami, thank you so much.
Thank you so much.
I think it's been enlightening, eye-opening. Anybody who wants to, is even remotely thinking about plastic surgery should watch this episode. It's so important to be informed. And where can people find you for consultations and such like?
At Upper Hill. Mirazi, that's 8th floor, room 809.
Okay.
Yes.
Online?
Mukami Gathareki.
Okay.
Yes.
Fantastic.
Yes.
And I'm sure, you'll be able to sort them out. I feel like, once they know they have somebody they can trust, it becomes an easier process as opposed to stumbling on things online as has been the trend. So guys, you've heard it. I think you're now more informed when you want to make this very important, very elective decision. Again, introspect why you want to do this, what is important about changing that part of your body. And again, I am in wellness. I will say, if your lifestyle is not healthy and you are not thinking about what you're eating, how you're exercising, then maybe start there and then go see the plastic surgeons, once you've established that this body fat is not moving anywhere, right? But there's no judgment, there's no shame, just get the right information. I think we cannot emphasize enough, get the right doctor who knows what they're doing. Again, it's a special edition podcast that can be found at annadives.club, where it's all happening, all the conversation, all the amazing masterclasses and courses and things to really elevate your life. Again, every Friday, right here, please subscribe, share this video with everybody who you think needs to learn more about plastic surgery, men and women included, so that they are more informed.